You open your eyes every morning, and before you even look at the clock, before you even think about your day, your mouth feels like sandpaper, dry, sticky, uncomfortable, maybe even a little painful. You reach for your glass of water on the nightstand, you drink, and you think, this is just getting older, this is just what happens. But what if it is not? What if that dry mouth every single morning is your body sending you a quiet but urgent warning? A warning that something much deeper is happening inside you, something that affects your heart, your kidneys, your blood sugar, your nervous system, and even your brain. Here's what most seniors never know. Waking up with a dry mouth every morning is not always about how much water you drank the night before. For millions of people over 60, it is a symptom, and symptoms are messages. Today I am going to help you decode that message, because what your dry mouth is trying to tell you might surprise you, and it might just save your health. Stay with me. Hello and welcome back to the channel. If you are new here, I am so glad you found us. This channel is dedicated to helping seniors and their families understand health in plain, honest, practical language. Today we are talking about something that affects an enormous number of people over 60, morning dry mouth. The medical term is xerostomia, but we are going to keep things simple today, because simple is what matters. Now let me be honest with you right from the start. Dry mouth in the morning can have many different causes. Some are simple and easy to fix. Others are warning signs of conditions that need medical attention, and some are serious enough that ignoring them could put your long-term health at real risk. That is why this conversation matters, because so many seniors dismiss morning dry mouth as unimportant. They do not mention it to their doctor. They think, I am just getting older. This is normal. But it is not always normal. And even when it is common, common does not mean harmless. So today, we are going to cover what morning dry mouth actually means in the body, the hidden conditions it may be warning you about, the medications that could be causing it without you realizing, the warning signs that mean you need medical attention, and practical steps you can take starting tonight. Let us begin. First, let us understand what saliva actually does. Most people never think about saliva until it is gone. But saliva is one of the most important protective systems in your entire body, and this is especially true after age 60. Here is what saliva does every single moment of every single day. It washes bacteria off your teeth and gums. It neutralizes acids that cause tooth decay and gum disease. It helps you chew and swallow food safely. It carries digestive enzymes that begin breaking down food the moment it enters your mouth. It protects the lining of your mouth from irritation and infection. It helps you taste food, and it contains proteins that fight bacteria, viruses, and fungi. Saliva is essentially your mouth's immune system. When saliva production drops, when your mouth dries out, all of those protective functions stop working properly. Bacteria multiply faster, acids damage teeth more aggressively, infections like oral thrush become more likely, swallowing becomes more difficult and more dangerous, and the risk of aspiration pneumonia, breathing food or liquid into the lungs, increases significantly. This is not a small problem. For seniors, dry mouth can lead to tooth loss, painful mouth sores, difficulty eating, nutritional deficiencies, and life-threatening infections. So when your mouth is dry every morning, your body is not just uncomfortable. It may be losing one of its most critical defense systems. Now let us talk about what might be causing it. Before we go further, I want to speak directly to you. If you are over 60 or caring for an elderly parent, spouse, or loved one, this information could genuinely be life-changing. Because morning dry mouth is one of the most commonly dismissed symptoms in senior health, and yet it can point to conditions that, if caught early, can be managed and even reversed. If this video is helping you connect some dots, please hit the like button right now and subscribe to our channel. We share honest, practical senior health content every single week. And please share this video with someone you love, who wakes up every morning reaching for water before they do anything else. They need to see this. Now let us talk about the 8 hidden warnings your dry mouth may be sending. Warning number 1. You may be more dehydrated than you realize. Let us start with the most common cause, dehydration. And before you say, I drink plenty of water, hear me out, because dehydration in seniors over 60 is far more common and far more sneaky than most people realize. Here is why. As we age, the brain's thirst mechanism becomes less sensitive. Young people feel thirsty when they lose as little as 1% of their body water. Many seniors do not feel thirsty until they have lost 2 or 3%. By that point, they are already meaningfully dehydrated, and they never felt it coming. Additionally, many seniors deliberately restrict fluids in the evening to avoid nighttime bathroom trips. This is completely understandable, but going to bed already slightly dehydrated means waking up with a very dry mouth. Then overnight, breathing through your mouth, sweating, and normal bodily functions continue to pull water from your system. By morning, the dryness can be significant. The fix seems simple. Drink more water during the day, especially in the morning and afternoon. Try to get most of your daily fluids before 6 or 7 in the evening, and keep a small glass of water by your bed for those middle-of-the-night moments. But here is the important part. If you are drinking enough water and still waking up with extreme dryness, something else is going on. And that takes us to warning number 2. Warning number 2, your medications may be drying you out. This is one of the most important and least discussed causes of morning dry mouth in seniors. More than 500 commonly prescribed medications list dry mouth as a side effect. 500. And the more medications you take, the higher your risk. Which medications are most commonly responsible? Antihistamines, including Benadryl and similar allergy medications. These are also found in many over-the-counter sleep aids. Antidepressants, especially older ones like amitriptyline. Blood pressure medications, particularly diuretics, which are water pills, and certain beta blockers. Bladder medications for overactive bladder, including oxybutynin and tolterodine. Anti-anxiety medications and sleep medications. Parkinson's disease medications, and certain pain medications. Now please do not stop any medication after hearing this. That could be dangerous. But do bring a complete medication list to your next doctor's appointment and ask specifically, could any of my medications be causing my morning dry mouth? Because sometimes a simple medication switch, dose adjustment, or timing change can make a significant difference. Many seniors have suffered from dry mouth for years without ever knowing it was their medication causing it. Warning number 3, you may have sleep apnea. This is a big one, and many seniors have no idea they have it. Sleep apnea is a condition where breathing repeatedly stops and starts during sleep. When breathing becomes restricted or blocked during sleep, the mouth often opens to get more air. Breathing through an open mouth all night long dramatically dries out the mouth and throat. If you wake up every morning with a very dry mouth and you also experience loud snoring that your partner complains about, waking up feeling exhausted even after a full night's sleep, headaches in the morning, frequent nighttime urination, or your partner has noticed you stop breathing during sleep, you need to be evaluated for sleep apnea. Sleep apnea is not just an annoyance. Untreated sleep apnea significantly increases the risk of high blood pressure, heart attack, stroke, irregular heart rhythm, type 2 diabetes, and depression. For seniors over 60, untreated sleep apnea can be genuinely dangerous. The good news is that modern treatments, including CPAP therapy and oral devices, are highly effective. And many people report dramatic improvements in their morning dry mouth within days of starting treatment. Warning number 4, your blood sugar may be too high. This is one that many seniors never connect to dry mouth, but it is critically important. One of the earliest and most consistent symptoms of elevated blood sugar and type 2 diabetes is increased thirst and dry mouth. Here is why. When blood sugar is high, the kidneys work harder to filter and remove it. This process pulls large amounts of water out of the body through urine. The result? Increased urination, especially at night, and significant fluid loss that leaves you waking up dry, thirsty, and sometimes dizzy. If you are waking up with dry mouth and you notice you are urinating more frequently than before, especially at night, you feel unusually tired, you have blurry vision, you have slow healing cuts or sores, or you feel tingling in your feet or hands, please ask your doctor for a fasting blood sugar test and an HbA1c test. That is a measure of your average blood sugar over the past 3 months. Type 2 diabetes affects millions of Americans over 60, and many people have it for years before being diagnosed. Catching elevated blood sugar early gives you the best chance to manage it and prevent serious complications. Warning number 5. Your salivary glands may be damaged or inflamed. Your saliva is produced by 3 pairs of salivary glands, located in and around your jaw and cheeks. These glands can become affected by several conditions that become more common after 60. Sjogren's syndrome is an autoimmune condition. That means the immune system mistakenly attacks its own glands, including the salivary glands and tear glands. This causes severe and persistent dry mouth and dry eyes. It affects millions of Americans, and the majority are women over 40. Many go years without a diagnosis. If you have chronically dry mouth and chronically dry eyes, difficulty swallowing, joint pain or fatigue, or dental decay that seems worse than it should be despite good hygiene, Sjogren's syndrome should be investigated. Salivary glands can also be damaged by radiation therapy to the head and neck area, or by certain infections, or by stones that block the gland's ducts. Swelling or pain in the jaw or cheek area, especially when eating, can indicate a blocked salivary gland duct. This needs medical evaluation. Warning number 6. Your kidneys or liver may be under stress. This one surprises many people. But kidney disease and liver disease can both affect fluid balance and saliva production. Chronic kidney disease is extremely common in seniors over 60, and one of its symptoms is a persistent dry feeling in the mouth, along with other symptoms like fatigue, swelling in the legs, and changes in urination patterns. The kidneys regulate fluid balance throughout the entire body. When they are not working efficiently, that balance is disturbed, resulting in symptoms that can include dry mouth, increased thirst, and a metallic or ammonia taste in the mouth. If dry mouth is accompanied by unusual fatigue, swelling in the ankles or feet, changes in urination, or a strange taste, please ask your doctor about kidney function testing. A simple blood test called a comprehensive metabolic panel can check both kidney and liver function. Warning number 7. Your nervous system may need attention. The production of saliva is controlled by the nervous system, specifically by the autonomic nervous system, which is the part of the nervous system that controls automatic body functions, things you do not consciously control, like heartbeat, digestion, breathing, and yes, saliva production. In some neurological conditions, including Parkinson's disease, multiple sclerosis, and diabetic neuropathy, which is nerve damage from diabetes, the autonomic nervous system can become impaired, and one result of this impairment can be changes in saliva production. If you have dry mouth alongside other symptoms like difficulty swallowing, changes in digestion, dizziness when standing, or other neurological symptoms, this connection deserves attention. Warning number 8. Anxiety, stress, and depression. The connection between emotional health and physical symptoms in seniors is often underestimated. Chronic stress and anxiety activate the body's fight or flight response. This is controlled by adrenaline and other stress hormones. And one effect of the fight or flight response is reduced saliva production. This is why your mouth feels dry when you are nervous, before a presentation or a difficult conversation. But when anxiety is chronic, when stress never fully goes away, the body stays in a low-level fight or flight state, and dry mouth can become a persistent symptom. Depression in seniors is also frequently associated with physical symptoms, including dry mouth, fatigue, poor appetite, and sleep disturbances. Many seniors experience depression without recognizing it, or without feeling comfortable talking about it. If you think emotional health may be contributing to your physical symptoms, please do not hesitate to bring it up with your doctor. There is no shame in it, and there are real effective treatments. Now let us talk about warning signs that mean you need medical attention urgently. Please seek medical evaluation if you have dry mouth along with any of the following: extreme thirst that water does not seem to quench, frequent urination, especially waking multiple times at night, unexplained weight loss, blurry vision, fatigue that is getting worse over time, mouth sores, white patches, or a white coating on the tongue. White patches in the mouth can indicate oral thrush, a fungal infection that is more common in seniors with dry mouth, diabetes, or weakened immunity. Difficulty swallowing or a feeling of food getting stuck. Persistent bad breath that does not improve with brushing. Swelling or pain in the jaw or cheek area. Dry eyes along with dry mouth. A metallic or bitter taste in the mouth. Rapid tooth decay or gum disease despite good oral hygiene. Any of these alongside dry mouth is a signal worth taking seriously. Do not wait months to bring these up. Mention them at your next appointment, or call sooner if they are worsening. Now let us talk about practical steps, because you deserve more than just a list of worries. You deserve a plan. Step 1. Hydrate strategically. Do not just drink more water randomly. Drink water consistently throughout the day, starting first thing in the morning. Aim for 6 to 8 glasses of water daily, more if you are active or the weather is hot. Try to finish most of your fluids by 7 in the evening to minimize nighttime bathroom trips. And keep a small glass of water on your nightstand for sips during the night. Avoid alcohol in the evenings. Alcohol is a diuretic. It increases urination and significantly worsens morning dry mouth. Caffeine in coffee and tea can also have a mild drying effect if consumed in large amounts. Moderate your caffeine intake and try not to have caffeinated drinks close to bedtime. Step 2. Breathe through your nose. If you are sleeping with your mouth open, that is a major contributor to morning dryness. Common causes of mouth breathing during sleep include nasal congestion from allergies or a cold, a deviated septum, or sleep apnea. Address nasal congestion with appropriate treatment. Ask your doctor about nasal strips or saline sprays. If nasal breathing during sleep is difficult, and as mentioned, if you snore loudly or wake up exhausted, get evaluated for sleep apnea. Step 3. Review your medications. Write down every single medication you take, every prescription, every over-the-counter product, every supplement, and bring that list to your doctor. Ask specifically, could any of these medications be contributing to my dry mouth? Is there an alternative that might have less impact on my salivary glands? Could changing the timing of any of these medications help? Do not stop any medication on your own, but do have the conversation. Step 4. Practice good oral hygiene consistently. With less saliva working as a natural cleanser, oral hygiene becomes even more important. Brush gently twice a day with a fluoride toothpaste. Floss daily. Use an alcohol-free mouthwash. Alcohol-based mouthwashes will make dry mouth worse. Consider using a dry mouth toothpaste or oral rinse, specifically formulated for xerostomia. These are available at most pharmacies and can make a significant difference in comfort and protection. Stay current with dental checkups. Tell your dentist about your dry mouth. They can apply protective fluoride treatments and monitor for early decay. Step 5. Stimulate saliva naturally. Sugar-free gum and sugar-free hard candies can stimulate saliva production. Look for those sweetened with xylitol rather than sugar. Xylitol actually helps fight the bacteria that cause tooth decay. Chewing gum after meals is particularly helpful for stimulating saliva. Sucking on small pieces of ice can also help with temporary dryness. Some people find relief with over-the-counter artificial saliva products, available as sprays, gels, or rinses. These do not stimulate real saliva, but they can provide temporary lubrication and comfort. Step 6. Humidify your bedroom. Dry air in the bedroom worsens morning dry mouth significantly, especially in winter when indoor heating removes humidity. A bedroom humidifier adds moisture to the air you breathe all night. Aim for indoor humidity between 40 and 50%. This simple addition can make a noticeable difference in how your mouth feels every morning. Step 7. Ask your doctor for appropriate testing. Based on what you have learned today, consider asking for a fasting blood sugar and HbA1c to screen for diabetes or prediabetes, a comprehensive metabolic panel to assess kidney and liver function, a complete blood count to check for anemia. If symptoms suggest it, testing for Sjogrens syndrome, evaluation for sleep apnea if relevant symptoms are present, and a medication review specifically looking at dry mouth side effects. These tests are generally straightforward, and they can answer important questions about what is really behind your morning symptoms. Let us bring everything together. Waking up with a dry mouth every morning after 60 is not something you should simply accept or ignore. Your mouth's saliva is a critical defense system, and when it dries out consistently, it can affect your teeth, your ability to eat safely, your digestion, and your overall health. Morning dry mouth can be a warning sign of many conditions. Dehydration that is more serious than you realize, medication side effects from over 500 commonly used drugs, sleep apnea, a condition affecting heart health, brain health, and longevity, elevated blood sugar or undiagnosed diabetes, autoimmune conditions like Sjogrens syndrome, kidney or liver stress, nervous system conditions affecting saliva control, or chronic stress, anxiety, and depression. The practical steps are clear. Hydrate strategically throughout the day. Breathe through your nose during sleep. Review your medications with your doctor. Maintain excellent oral hygiene with the right products. Stimulate saliva with sugar-free xylitol products. Humidify your bedroom, and ask your doctor for appropriate health screening. Because morning dry mouth is not just a comfort problem. It is your body communicating, and it deserves to be heard. To every person watching this, who has been reaching for that water glass every morning for months or years without ever asking why, today is a good day to start asking. You are not being dramatic. You are not overreacting. You are paying attention. And paying attention to what your body is trying to tell you is one of the most powerful things you can do for your health after 60. Your comfort matters. Your oral health matters. Your kidneys, your heart, your sleep, and your blood sugar all matter, and they are all connected. In ways that morning dry mouth may have just helped you see, take this information to your next doctor's visit. Ask the questions. Get the answers. You deserve them. If this video helped you understand something about your own health that you had been ignoring or not sure about, please give it a thumbs up. It helps more seniors find this information when they need it. Subscribe to our channel and hit the notification bell for new senior health videos every week. Share this video with someone you care about, a parent, a spouse, a sibling, a friend who wakes up every morning with a dry and sticky mouth. They deserve to know what it might mean. And comment below. Do you wake up with dry mouth every morning? How long has it been happening? Have you ever talked to your doctor about it? I read every single comment, and your story may be exactly what someone else needs to hear. Thank you so much for watching. Take care of yourself. And I will see you in the next video.